Which of the following best describes the term aging reports in the context of medical billing? Now let's pretend that you're not familiar with the term aging reports, and we'll go back and discuss. But you do see aging reports is listed here, and you see in the context of medical billing. So let's just glance through the choices and see if there's anything that we can eliminate just based on knowing it has to do with medical billing. Because if we look at our choices, they all involve age, something involving age, because the question is discussing aging reports. Age, and then I don't mention it, but we'll look through what that means. Now, in option A, let's say, reports that detail the age distribution. This is discussing a distribution of age of the patients. Option B is saying age of medical equipment in the facility. And then option D says age-related medical conditions in the practice. However, we see that in the question, they're discussing medical billing. So even if you're not sure what aging reports are, you could infer that anything having to do with distribution of patients, medical equipment, medical conditions is probably not what we're looking for because the question is discussing medical billing. So if let's say we'll eliminate this, but we'll discuss it further before we officially eliminate these, that would leave us with option C, which says reports that show unpaid patient balances and how long they have been outstanding. And that is actually the correct answer here because aging reports relates to your accounts billable, and it has a list of invoices and anything that's due for the patients to pay, and that's because this has to do with medical billing. And the aging reports is a term used in medical billing to show the patient's account billable to see what's still outstanding for them to be paying. So now that we have that in mind, we could officially eliminate the other choices because we see option A says reports the detail of age distribution of patients in the practice, and that's not what aging reports really means. Option B says reports that track the age of medical equipment, and that's not what aging reports are. Reports that detail the age-related medical conditions, and that's not what aging reports really means either. So that leaves us with option C, reports that show unpaid patient balances and how long they've been outstanding. That's what aging reports really is. So they're trying to trick you by inserting different things about age-related conditions or anything related to age into options A, B, and D. But even if you were not sure what an aging report really means, you could actually get to the answer because they did tell you that it's in the context of medical billing. So use those clues to your advantage, and then you'll arrive at option C, which is correct.